As a member of AACR, I am honored to serve as chair for the AACR-Minorities in Cancer Research, or MICR, Council, where I have had the opportunity to witness the many contributions this group has made to the advancement of minority investigators and cancer health disparities research. This year, we're delighted to recognize and celebrate the 20th anniversary of MICR as a membership group within the AACR. I know we would have all loved to have had the opportunity to celebrate face-to-face in Miami, but we're still extremely honored to have the current moment to reflect and absorb the incredible contributions that MICR has made in the area of cancer research. It all started in 1999 when the AACR CEO, Dr. Marge Foti, thought it would be beneficial to have a leadership group within the organization that addressed the needs of minority investigators. In 2000, at the beginning of the new decade, the Minorities in Cancer Research, or MICR, was formed after unanimous approval by the AACR Board of Directors. Marge, we can never thank you enough. Your unyielding support of MICR and the programs and activities organized by the MICR Council have paved the way for increased scientific and professional development opportunities for underrepresented minority scientists in cancer research. MICR is a membership group within the AACR committed to preventing and curing cancer while meeting the professional needs and advancing the careers of racially and ethnically diverse cancer researchers. MICR membership is open to all AACR members who support the mission and are interested in joining. I strongly encourage you to join if you are not already a member. The MICR Council consists of 13 members who possess expertise in the broad spectrum of cancer research from basic science through clinical research. This important group acts as an advisory board to the AACR leadership on issues of concern to minority investigators. It spearheads MICR programs and activities and champions MICR's goals that are central to supporting the careers of minority investigators and to accelerating advances against cancer in all populations. The goals of MICR include increasing the number, participation, visibility, and recognition of minority scientists in cancer research, developing programs that address the professional needs of minority scientists in cancer research, providing diversity globally in the cancer field and within the AACR's membership, programs, committees, and leadership, addressing disparities in cancer incidence, morbidity, and mortality faced by racial and ethnic minorities and other underserved populations, advocating for relevant, effective science and public policies, and assuming other such roles, such as those deemed necessary or appropriate for MICR's mission. Over the past 20 years, the MICR membership has grown to over 5,000 members, and the proportion of minority investigators in the AACR has grown from 2% to 11%. We've come a long way, but we still have a ways to go. Our concerted efforts to eliminate cancer health disparities and to assist in the professional advancement of minority investigators in cancer research have resulted in an increased AACR membership and highly successful MICR programs and activities. For example, in 2006, MICR organized a think tank, which resulted in the launch of this groundbreaking conference on the science of cancer health disparities. Over the past 13 years, the MICR Council has, in collaboration with AACR, worked to bring you this important and innovative conference annually. Other successful MICR initiatives and activities have included the AACR MICR Jane Cook Wright Lectureship, which is presented annually to an outstanding minority researcher, a long-lasting relationship of over 35 years with the NCI Center to Reduce Cancer Health Disparities, and funding of early career minority researchers, minority faculty, and faculty at minority-serving institutions, essential feedback and proposed changes to the Blue Ribbon Panel report for the White House Cancer Moonshot Initiative, contributions to the AACR Vision 2020 strategic plan intended to increase the visibility and professional development of minority scientists, and most recently, a call to action from the AACR and MICR on eliminating racism and racial inequalities in cancer research. These activities have been successful because of the contributions of many, but especially the efforts of the past MICR Council chairs. I have to recognize and thank each of them for all that they have done in spearheading these initiatives. They are Dr. Lucille Adams Campbell, Dr. Alex Ajay, Dr. Beverly Lynn Cook, Dr. Judith Cower, Dr. Carlos Casiano, Dr. Dwayne Smoot, Dr. Jean Ford, Dr. Eddie Reed, Dr. Maria Elena Martinez, Dr. Levi Garraway, Dr. Marcia Cruz Correa, Dr. Christopher Lee, Dr. Chanita Hughes-Halbert, Dr. Edith Perez, Dr. Rick Kittles, Dr. John Carruthers, Dr. Brian Rivers, and most recently, Dr. Laura Fejerman. I also want to thank the MICR member volunteers who serve on the council over the past 20 years. This small but mighty group of dedicated individuals have year after year committed their time and best efforts in support of minority investigators. Our sincere thanks to all of you. Lastly, congratulations and thanks to the minority investigators who are trailblazers, those who have demonstrated exemplary scientific achievements that have impacted the field of cancer research. The champions, those who have made significant impressions as role models and have a track record for diversity in cancer research training and workforce development. Early career researchers who are rising stars and emerging leaders in the field of cancer research whose records reflect ongoing contributions and excellence in the mission of the MICR. And of course, all of the MICR supporters who have made contributions to MICR activities throughout the years. Along with my current colleagues on the MICR Council, we'd like to thank you all for your contributions. There's much more work to be done, and I look forward to working with all of you in our continued and united efforts to highlight and support minority investigators for many, many years to come. So thank you, and happy 20th anniversary, MICR. Thanks.
Wow, it is the AACR-Minorities in Cancer Research Council 20th anniversary. Congratulations to all the MICR members, to all MICR councils, for working together to advance the science to promote the best practices for the patients that we serve. There's been 20 years of many accomplishments, but there's much more that we need to do. Congratulations, let's celebrate, and let's keep working together for the next 20 years. Thank you to the AACR. Thank you to Dr. Marsh Foti for believing in this mission, for giving us the resources and the space to continue to promote the best science to develop for all those patients that need us. Congratulations.
Greetings from Atlanta, Georgia. My name is Brian Rivers. I'm the former chairperson for the MICR Council, as well as current MICR member. I would like to take this opportunity to wish a very, very special happy anniversary to the MICR. Celebrating 20 years is not an easy feat, and we applaud the efforts of AACR for establishing this platform for the advancement of minority investigators in cancer, as well as professional development and advancement of the science for cancer disparities. Although we are not together in Miami, I know that you will celebrate in your own right, as many of you have probably been benefactors like me to the activities and the programs of MICR. Again, thank you for establishing such an incredible platform and wishing nothing but the best in all future endeavors as it relates to MICR. Happy 20th anniversary.
Good morning. My name is Chanita Hughes-Halbert. I'm from the Medical University of South Carolina. I had the honor of serving as chairperson for the Minorities in Cancer Research Council from 2014 to 2015. And it is my pleasure to congratulate past and current members of the MICR for 20 years of leadership that has changed the growth and impact of cancer health disparities research. The field has come a long way, and I'm excited about the future for our basic, clinical, and population-based studies that will continue our progress to achieving cancer health equity. Congratulations again.
Dear AACR, I am proud that the American Association of Cancer Research commenced the Minorities in Cancer Research Council. It's been a wonderful 20-year history that has led to the most successful Disparities Conference in the nation and the first ever Disparities Progress Cancer Report. I've developed multiple wonderful colleagues as well as staff through the AACR in the role, and I'm proud to continue to support MICR in their continued quest to reduce cancer disparities. Thank you and congratulations on your 20th anniversary.
Hello, I'm Laura Fejerman, Associate Professor in the Department of Public Health Sciences and Co-Director of the Women's Cancer Care Program at the UC Davis Comprehensive Cancer Center. I'm also past chair of the AACR-Minorities in Cancer Research Council. As member of MICR for the last 5 years, I have been able to witness firsthand the commitment of the AACR leadership and the members of the Council to advance the science of cancer health disparities and promote cancer health equity. I have also felt the passion and persistence with which this group pushes to diversify the pool of cancer researchers by supporting the career of young minority investigators who face unique challenges, more so now in the context of the COVID pandemic. As we're celebrating the 20th year anniversary of MICR, I would like to thank those who had the vision for the need to create this council and the force to make it a reality. Thank you, Dr. Margaret Foti and Sonia Springfield, for amazing leadership. Happy 20 years, MICR. This is time to celebrate despite of everything else. Congratulations.